And it's my pleasure to welcome Dr. Williams. She's an associate professor of medicine in the section of geriatrics and palliative medicine at University of Chicago. And her clinical, scholarly, and leadership focus lies in providing culturally competent care and support to patients and their caregivers in the healthcare and community setting. She's director of the Geriatric and Palliative Medicine Education at the Pritzker School of Medicine, and her work is heavily embedded in the community in which she practices. We've invited her to talk about one of the 4 M's. The 4 M's are a framework that that has been developed for the healthcare organization to deliver care that meets the needs of their patients and clients. It was developed by the Institute for Healthcare Improvement, and University of Chicago has embraced the 4 M's. We hope to present a program on each one of them. We're starting out today with the one of the 4 M's that stands for what matters, as you can see on the screen. And this is focused on how a person like myself or anybody on the call who's who's receiving care from the healthcare community can communicate most effectively about what matters most to our health and the healthcare we're receiving. So welcome, Dr. Williams, and we'll turn the program over to you.
Thank you, and thank you all for the invitation today. So today we'll be talking a little bit about what matters as it reflects on our healthcare and who we are as an individual and how that helps to navigate our healthcare choices. Again, the 4 M's is a curriculum which is focused on creating more age-friendly health environments, and Share Network very much so wants to be able to empower the older adults that we work with within our network to know about conditions related to aging, things that put us at risk and that we can easily modify to be in the best health possible. And these presentations are not only intended as informational, but empowerment for you in navigating your healthcare. So we would really love to get your feedback as we present these 4 M presentations to you. Today, we're going to do what matters, but we ask at the end of every one of these presentations to provide us with 5 minutes of feedback. And we'll make sure that you receive a feedback form. And our primary PI for this research project and getting information on our presentations for 4 M's is Dr. Lauren Gleason. So Share Network, which many of you may have heard of, is an organization which is nationally funded through the US government, but it's embedded within the University of Chicago Department of Geriatrics and Palliative Medicine. And it's very much so focused on its name, supporting healthy aging resources and education for older adults throughout the Chicagoland area. So our agenda for today is going to involve figuring out what does the term "what matters" mean, and determining how to best communicate our healthcare wishes to our providers, as well as learning a little bit more about what is advanced care planning and how to go about that process, and then resources to help in advanced care planning. So if we think about the 4 M's, again, it's creating age-friendly health environments. And that means different things to different people, but U of C actually has been awarded as an age-friendly healthcare system, one which empowers and creates an environment that focuses on older adults. And one of the key ways that we can do that is by focusing on issues that are related to aging. So definitely mobility is an issue that can change with aging. Mentation is a condition that can change with aging related to conditions like depression, dementia, delirium. Medications and the appropriateness of them is definitely something that can matter as far as aging. But then also what matters. That's a term that oftentimes people scratch their head and they're like, what do you mean by that? And really what matters is trying to align who you are as an individual and your value system to help those values navigate what is in your best interest as far as your healthcare. So if you think about what matters to you, and this is, please everyone take your mute off. I'm just going to ask in a round robin, what matters most to you? Everybody's got one sentence. I'm told I have to specify brevity. So I'm going to just ask everybody to just share with me what matters to you. And I'm going to jot down a little bit of this. Anyone can start.
I would say quality of life.
I love it. Quality of life. Anyone else?
Staying engaged.
Engagement. Lovely. What else?
Mobility. I see people much younger than me with poor mobility, and it cuts into their social life. Mobility, mobility.
Mobility. I love it. What else?
Purpose.
Say it one more time.
Purpose.
Purpose. Love it.
Purpose.
Anyone else?
Friendship and family relationships maintained.
Connection and relationships. I love it.
Family.
Family. Anyone else who hasn't spoken? No one else? So thank you so much for stating many of those things that matter to you as an individual. One of the key features I heard is variety in what matters to you. Everyone is different. Everyone has a different thing that matters most to them and helps them to sort of navigate through what makes sense as far as their healthcare. So that's what we mean by what matters. What is a key value or key goal or focus in your life that you use as a navigation system towards healthcare that is consistent with what matters to you? When we think about it and we're having conversations with patients about what matters to you and what does it mean, it can be a myriad of things to different people. Sometimes it's their belief system. Some people feel that faith and God navigates through their healthcare, and they don't want to make a plan because they feel like their faith is challenged when they make a plan. Some people, based on their cultural preferences and experiences, navigate through the healthcare system very differently than others because of those cultural backgrounds. Some people, because of legacy and a desire to leave a certain amount of wealth or a certain amount of information for family, have specific choices that they navigate as far as their healthcare based on those choices. But just as you see many different examples of what matters to an individual here, we heard just as many different examples from you as a group who's very much so connected, and you spend a lot of time together in your organization, but you're all very different as far as your values and what matters to you. So I'm going to ask any questions so far on what matters and how we're defining it. These are a few examples of how individuals might be able to navigate through their value systems and what matters to them when they're talking with their physician. A physician might ask something like, what's important to you today? What are important things to focus on as far as your care? What do you worry about related to your care? What are goals you're hoping to achieve within the next 6 months, in the next year, given where we are with your healthcare? What do your providers need to know about you as an individual to provide the best care possible for you? What else would you like us to know about you today? And how might that help as far as navigating your care? Have any of you ever been asked any of these questions by a physician or a nurse practitioner? No?
Not really.
I'm
Not
sorry?
really.
I can't hear you, Mary.
Not really, not directly.
How would you feel if you were asked some of these questions?
Well, at this stage of my planning and concerns, I would feel very good if a provider asked me, especially a primary care provider, well, also some of the other specialties I'm having to deal with.
Yeah.
I think it's really important, and I wasn't able to connect that way with my new primary care doctor, and I wish this talk had come before I saw her.
And Mary just mentioned something very important, everyone. She mentioned these sort of questions build connection with your primary care providers. It helps to build a connection, but it also helps them as far as getting to know who you are as an individual, what do you value, and how those values and you as a person should be navigating through your healthcare choices. And it makes it really hard for a physician to be able to give recommendations or support for medical care if they don't have a good sense for who you are as a person. So these are, a few of the questions that a physician may present to you as far as getting to know you. But you can also turn these questions right around on the physician and utilize them to advocate for who you are as an individual. Today it's really and truly important for me to maintain my current mobility. I feel like mobility is health and wealth. And it's more important to me to be able to get around and do things with my family than anything else. Can you tell me how to best optimize my mobility? So that might be an example of how you can turn these questions around and empower your own healthcare with your physician. Let's go a little further. Many of these reflections on what matters to you may be different for an individual, and maybe a different cap that you're putting on as far as thinking about this and figuring out how to express it to your healthcare provider. So these are just a few ways that you might really and truly be able to sit down and plan and organize. How do I best let my physician know what matters most to me and what I want to make a major focus as far as my values and how they help to inform my healthcare decisions? So you might do that by journaling about things that you really treasure and value, or it might be a moment of prayer or meditation that you come up with an aha moment about what truly is a goal or a motivation as far as what you want to focus on with health. Or it might even be talking to a family member about what's important to you, or even talking about something that you've seen as changes in one of your loved ones that you may never want for yourself, and really being very forthright with, this is not what I want. This is what I truly want. Have any of you all ever done any of this? Sort of sat down and wrote out what's important to you?
No,
Well, I haven't written it down, but I certainly think about it and talk with my husband about it.
Mm-hmm. And I think that's powerful that you've had those conversations with a family member, and a family member who may at some point, during the course of your lifetime, be very involved in helping you make a lot of those health decisions. It's important to talk to them and let them know. Have any of you all ever had a weight on your shoulders where you've been trying to make healthcare decisions for a loved one and hadn't had any conversations? I have, and it's hard. It's really hard. So the more that you talk to your physician and loved ones about what matters to you, the more you empower yourself with care that's going to reflect you.
mm,
Does that make sense?
yes.
All right.
It makes sense. The thing that's hard is when you talk with family members about a loved one, say you talk with your sibling about your parent, it's when the two of you have different approaches. That's really difficult.
It is, but you know, one of the things that you can do in those types of situations is put the parent in the equation and really and truly challenge one another and ask, who is mom? Who is mom at the core? What sort of things matter most to mom? Aha, it's really important for her to be with us as much as possible. It's really important for her to try to be as independent as possible. Let's talk with mom and her doctor about what resources can help us achieve those goals. So rather than deciding what sister one and brother one want, it's really turning it back to the individual person and their values and what matters most to them. Does that make sense, guys?
Yes.
Okay. So let's do an exercise. Let's meet George. We're going to meet George in two different scenarios. This particular scenario of George is George being very proactive and really and truly taking the time to reflect on what matters most to him. And as a result of that, George has done some planning for himself. So George is 80 years old. His favorite thing to do is go to a White Sox game with his grandson. I hate it if anybody's a Cubs fan, sorry, but they love the White Sox. So because George knows that's something really important to him, George has sort of taken time to state what's really, really important to him. He says that he wants to be able to stay home as long as possible. So George plans for that. George hires a contractor to install bars in his bathroom, and he moves his bedroom down to the first floor. And he does all of this because George has really bad arthritis and his knee gives out on him sometimes. And he's really been afraid of having a fall as a result of it. And he knows he can't get to those games with his grandson and he can't stay at home if he has a big fall and has a big trauma as a result of it. So he starts using a cane so that he's got more support with that knee. He does the grab bars, and therefore he knows that he's going to limit his risk for a fall and be able to stay at home. George also states that he wants to be able to leave an inheritance to his family. It's really important that he lets them have a legacy. So he meets with his attorney and he sets up an estate for his property, and he sets up a will for all of his assets so that his family will be well taken care of. And then George goes further to state that he really does not want to be a burden to others. He wants to be independent as possible, and if he can't be, he doesn't want his family to be burdened. So he talks with his doctor about advanced healthcare planning so that his family knows what his wishes are and they know what kind of care is appropriate for him if he gets to a point of incapacitation. So that was George the planner. We're going to meet George in another realm. We're going to meet George as a different type of person, as someone who's able to state his wishes, but hasn't taken the time to plan. George has been procrastinating. So he's still the same guy who wants to stay at home as long as possible. But guess what, guys? George didn't make a plan. George suffers a fall as a result of not making a plan because his knee gave out. And when he went down the stairs at night, he fell, hit his head, had a bleed in his brain, and has experienced decreased thinking and memory as a result of that. And he also broke his hip, so he had to have hip surgery. So he's no longer able to live at home. He can't be independent anymore because he didn't take those steps and be proactive. He still wants to be able to leave an inheritance to his family, but he's no longer able to do that because he spent most of his finances on being in a nursing home. He's not just there for rehab. He's having to live in a nursing home now because he's got decline in his cognition because of the brain bleed. And he's also had this hip fracture and he's never really been able to ambulate on his own well anymore. And then he doesn't want to be a burden to others, but unfortunately, because he didn't do any of this planning ahead of time, his family's got that weight on their shoulders trying to figure out what's in George's best interest. Does this sound in any way familiar to you? I see it a lot with some of my patients who we've tried to start the conversations, but either procrastination or discomfort with having a conversation has limited the documentation. Have you guys experienced this with anyone you know? The lack of preparation? No? That's a good thing if many people you know are talking about their wishes and what matters to them. So I think documenting what matters to you and making a plan for how to achieve healthcare that's reflective of what matters to you is what's important. It's not just stating what you wish, but you also have to be able to make a plan for it. And that plan usually involves discussion with your healthcare provider, but also discussion with your family members as well. So I'm going to ask you all as a group to take a challenge at meeting another patient. We met George, but I'm going to ask one of you to role play as Annie in this next slide. And we'll hear a little bit about Annie's health. And I'm just going to ask you all to tell me how you would plan for maybe two things that Annie states. So who wants to volunteer to be Annie? No one? No one?
I'll be Annie.
Thank you. Can you state your name again?
Nancy?
Nancy. Thank you, Nancy. All right. So Nancy, you are 75 years old. You live with many medical conditions, including high blood pressure, heart failure, and osteoarthritis. Sorry for the laundry list. You enjoy going to church. You enjoy going on walks to clear your mind. And you want to live as long as possible at home. So what are key ways that you could plan for the things you're stating are important to you? What do you identify as really important to Anne?
Well, she wants to be mobile and she wants to be independent. She needs to stay in close touch with her doctor because of these medical conditions. It sounds as though she likes to be connected to people through church.
Mm-hmm.
And that probably has some nice bonds there that kind of makes her not feel lonely if she's by herself. She certainly relates to nature if she goes on walks. So that's a way to kind of relax, get some exercise, feel at peace.
Awesome. So can anyone speak about one way that she might maintain a lifestyle that's reflective of the things that are important to her? You mentioned one, Nancy Ann. I'm going to call you Nancy Ann from now on.
That's great. That's actually my name, Nancy Ann.
But you mentioned staying connected to her healthcare professionals so that her medical problems are stable. So that's one way. Anything else that she might do?
I'm wondering if she might find a walking companion. She isn't going by herself on these walks. And that would answer two of the conditions. One, her connection with others, as well as safety.
Love it. Love it, Susan. What else? She mentioned another thing that was really important was staying at home as long as possible.
I would suggest that encourage her and support her contacting her clergy person to see two things. One, if they can get her a ride to church and back home,
Mm-hmm.
and or if they have a friendly visitor program where somebody from the church could periodically come and call her or visit her.
Love it. Love it.
Oh,
That's-
I think she should join a village.
I agree. I agree.
It takes a village.
It
Yeah,
takes a
right.
village. But you know, one of the things that you all mentioned, being connected to organizations, church or villages, that's a way to find out about resources as well. You know, it doesn't just have to be the doctor's office. That's a way for her to find out about resources like Department on Aging, which might be able to get resources like a homemaker in place to help with heavy cleaning, to avoid her having a fall trying to mop the floor. Or it might be a way to get her Department on Aging homemaker services to do shopping for her to stay at home much longer. So there's many different resources that are available, but it's hard to know what's needed and the prioritization of importance unless you know what matters to the individual. So that's why it's so important to talk about this, not only to your primary care physician, but also to your family and friends. And even more important with family and friends, in addition to the healthcare provider, because the family and friends are often the person chosen to help advocate for your wishes if you get to a point where you can't for yourself. Okay? So how do you communicate much of what matters to you with your healthcare provider? I think something that's really important is being honest. Everybody's different. Everybody has a different focus. Some of you mentioned quality of life is a big focus, but to other people, the amount of life, the quantity of life is most important. And they're willing to live at any level of healthcare just to be here on the earth. And many people put judgments about that, but there shouldn't be any judgments. It's important to be honest about what's important to you. It's important to share what's not important to you, just as what is important to you. It's important to write down questions and make sure that you get them answered by your healthcare professional. It's also important to bring family members with you so that they can hear a little bit about what you're concerned about and be there and present if you want to do any specific documentation. It's important to take notes. And it's also important to not be afraid to speak up and advocate for yourself. And sometimes that can be intimidating in a doctor's office. You know, a lot of people think, oh, that's the medical turf. But no, for that 30 minutes or 15 minutes when you're in the room, that's your turf. And you should be very vocal about what you need. Any questions about this slide so far? So from the provider standpoint, we really do. We want to know what matters to you because that's the only way for us to make informed recommendations about care. So really be forthright and forthcoming with what you're thinking and what you value. We want to allow the patient to make changes in their care that is appropriate based on their value system. And we really are appreciative when patients are making healthcare choices that are informed by their values. Does that sound foreign to you? How do you all make decisions now about your healthcare?
Well, I recently went through an experience where I had to make some important decisions, and a friend mentioned the book Being Mortal by Atul Gawande. And I got hooked on it on a Sunday, and I finished it Sunday, and I saw my primary care physician on Monday, and it totally gave me a whole new perspective on how to make decisions.
Love it. What was the biggest thing that you took away from that?
The biggest thing I took away from it is I have a right to do what I need to do for myself. No matter what medical opportunities are available to me, I know my body and I know what I think it can endure. And the book just gave me courage to put together all these questions for my doctor, who's known me for 30 years. So she really listened, and she really knew what I was saying because she knows me.
Mhm.
And since I've made that decision, which is not to do some radiation, I have read more and more and more that it's probably best that I don't at my age. The problem is that the advice I got is probably fine for a 40-year-old woman with 3 kids at home. And when you're 76, there's no studies that show what the results will be for your age group. And I'm hoping that as we become an older society, that more studies will be done on aged persons, so we'll have a better sense of how to make decisions.
Love it, Nancy. So you said some really important things. You said that it's not a one-stop shop. Decisions are not just, this is the right decision for everyone. Everyone's different. You also mentioned it takes courage and it takes forethought to be able to really and truly state what your wishes are. And you also mentioned something else really important, that you wanted to be your own advocate. So that's what matters means, is being your own advocate and being able to state who you are, what you value, and how that impacts your decisions for your medical care. So really important. Any other thoughts? No? All right. So when you're communicating with your physician, those are some of the ways that you can do it. But I think it's also equally important to communicate your value system with your family and friends. And the reason being that very often an individual may have a point in time where it's difficult for them to be able to advocate for themselves. They may be infirmed with an illness like pneumonia. They may have a stroke. They may have whatever ailment that makes it difficult for them to be able to fully be present and able to express their wishes. And who do we look to in the medical community to make decisions for that individual? Family and friends that they have previously documented should be their advocate or healthcare power of attorney. So it's important for you to talk with your family and friends about your wishes. And you can prepare for that conversation with things like, what do you think about, or what would you like to do if you feel ready to have this conversation? For you to sit down and jot down what your wishes are. Think about them at first. We talked about prayer, we talked about meditation, we talked about journaling. You can do any of that to prepare for the conversation. And then ask about, do you have particular concerns that you want to be sure to talk about with that loved one? Is really important too. And it might be something as important as, if I have an event where my breathing stops or my heart stops, I do or don't want this kind of care. Or it might be something such as, if I ever get to a point where I'm in the hospital, I don't want this person to visit me, but I do want this person. So it's really you sort of deciding what's important to have as far as that conversation. Starting the conversation should be early and it should be revisited. And the reason why it should be revisited, what's important to you today may be very different to you 2 years from now if your health changes. So that's why it should always be revisited. And then ways to break the ice might be, I need to think about the future. Will you help me? Can we have a conversation about my future care? Or I need your help with something. Can we have a talk next week? Or it might be, remember how cousin blah in the family died? Was it a good death or was it a hard death? Or it might be, I want my death to be like this. So these can be many of the ways that you can start that conversation with a loved one. What if things change over time? What if you are facing a new health challenge? Let's say your doctor has sent you for some blood work, and we see that you're having changes with your liver function, or you have a chronic health condition like heart failure, and you've had a recent test that shows your heart function is worsening. What you may have chosen for your health care 3 years ago may be very different in the setting of this new information. So with new changes in your health, it may be important to talk to your physician and loved ones about, if my health condition were to worsen, this would be an important goal for me to focus on at that time. And that can be anything. It might be independence is important at that time, or maintaining functionality, or not being in the hospital repetitively. Other things that you might want to discuss if there's a change in health would be, these are a few of my fears as my health conditions. I fear being in a hospital regularly. I fear being in a nursing home. I fear having my husband wipe my bottom. You know, these are real fears that a lot of people may have. Or what abilities are so critical to me that I can't imagine living without these abilities, might be something that you would discuss. Or if I become sicker, how much am I willing to go through for the possibility of another day? Have you guys ever thought about any of these questions? They can sound kind of scary, but could you imagine how scary it would be if someone's faced with making those decisions for you and they have no clue how you would answer them? So in some ways, this is a gift for you to be able to think about what you would want in this situation, but it's also a gift to someone you love to be able to express to them directly what your wishes would be. So these are direct questions that, as a palliative care physician, I ask a lot of patients who have serious illness, who are facing a change in their health. But these are also questions you can turn back on your primary care physician and use to empower you and state what your wishes would be in this type of scenario. Any questions?
The question I have, Dr. Williams, wait a minute, where was it? Sorry. Yeah, I mean, many of us, at least I've gone through the form that indicates if the doctor says you have a terminal condition and you're really not going to be able to recover, then you don't want life-saving measures. But that is, well, I don't know, that's just so general. The last question makes me realize how general it is, because there may be various circumstances where you're pretty sick, but you still have at least one faculty that can function, your sight or your hearing or whatever. And even if you're bedbound, you still have some quality of life. I don't know how you deal with the nuances of that last question.
And that's such an important point, Mary, which is this means different things to different people. Some people may feel like if the destination is to be bedbound, I don't want it. And then other people may feel like if the destination is bedbound, but I'm still here on earth with my family around me, that's a good scenario. So that's the importance is in asking these kinds of questions, is getting a sense for who is the individual person and what kind of things would they value given their medical situation and their value system, because it's different for every single person. So you're totally right, Mary. And Mary, you gave a good segue to the next portion of the slides, which is just about advanced care planning. And advanced care planning is really about that point in time when someone does have a critical life-limiting problem, and what would they want as far as their care if in that situation. So advanced care planning can be done well ahead of time before you get to a point where you have a life-limiting illness. And probably the best time to do advanced care planning is when you are in a good state of health, because you're able to think more clearly about what would I do if I were in this poor state of health with very limited amount of time to live and very limited functionality. How would I want my medical care to focus at that time? So with advanced care planning, it's a process, meaning that you don't just sign papers and you're done for the rest of your life. Anything that you document can always be changed if your values and wishes changed. And it's really important to facilitate it with your goals and your values being the navigation system for what you choose. Okay. So when you're having a conversation about advanced care planning, it's important to document the conversation. It's also important to set a follow-up plan so that you can do next steps. You don't want to really have that procrastination that we heard in George happen, because we never know what can happen in life. It's important to check in regularly with your physician if there are changes that are occurring. And it's important to determine what are the next steps. After you've had that conversation about what your wishes are, it's important to get the forms, talk to family members, document, make sure everybody's got a copy, and not procrastinate. That's the key thing. So if we think about the advanced directives, you've had the conversation with your doctor, you've had the conversation with your family, and now it's important to put those wishes in paper. So one way is with the living will portion of an advanced directive. That's where you state what kind of care you would want if you have a life-threatening illness or a terminal illness. You can state whether or not you would want to be on a breathing tube or whether or not you would want chest compressions. You can also put additional wishes in these living will forms about whether or not you want things like dialysis or whether or not you would want to be within a nursing facility ever. Our Illinois form primarily focuses on things like whether or not you would want chest compressions or a breathing tube, but many forms can be modified to express other wishes. The living will portion is where you state what kind of medical treatments you do or don't want. Any questions about the living will portion? Does anyone know the other portion of an advanced directive besides the living will? Have you guys?
A state document.
It is. It's every state has a different document. So this is the one for Illinois. So every state has a different document. But the other portion of an advanced directive is the healthcare power of attorney. The individual that you trust to help make decisions if you ever get to a point where you can't. Okay. And then we also have a third form that's really important and that a lot of people like to set up in the event that they have an arrest in their homes. They can have a physician order for life-sustaining treatment where there's an actual order that you can put on your refrigerator for EMS to see, and it states your wishes about what kind of care you do or don't want if you have a cardiac arrest, meaning your heart stops or breathing stops. And then you're also even able to document in this physician order for life-sustaining treatment who your power of attorney is. And then your physician signs this form too. So very often, many people who are in long-term care facilities like a nursing home, or people who live in an aging community like a Montgomery Place, they very often on their refrigerators in their homes have these forms that are signed by their physician that state their wishes and values for care if they have a cardiac arrest. So there's 3 components. One is the living will, where you state the kind of care you want. 2 is the healthcare power of attorney, where you state who you trust to give care decisions. And then 3 can be an order by your physician called a pulse form. It's a physician order for life-sustaining treatment, where you state your wishes for care if you have a cardiac arrest, meaning your heart stopped or breathing stopped. So that's how you can document many of these forms. Big tips for preparing these forms are: make sure you discuss with your healthcare provider, make sure you discuss with family and friends, and let them know your wishes, especially the person that you've chosen to be your healthcare power of attorney. Make sure to make multiple copies of these forms. Give one to your healthcare power of attorney, one to your physician. Keep one in your special files, and keep one in an easy to access area in your home. Make sure that you review and revise your directives as your health changes. If things change, it's all right for you to revisit and revise your forms with your physician and your healthcare power of attorney. And I'm going to show you a few resources that you can think about if you have not done this preparation. The Share Network has the resource guide, which talks about different attorneys that do estate planning and healthcare power of attorney planning. Prepare for Your Care is another website you can go to. The Center for Disability and Elder Law, the City Senior Centers also is another venue. And then this Conversations Project is another site that you can go to for help with preparation of your wishes. And I am going to ask you, as I promised in the beginning, to please take a moment at some point today and just fill out an evaluation for this presentation. And I'm also going to ask you to take away some of these major points. Take time to reflect on what matters to you. It's important to share your wishes with others. Speak up with your healthcare team and be specific about what matters to you, and make sure that you complete an advance directive. There's got to be at least one question. Yes, Rita.
When you say healthcare team, to whom are you referring exactly?
Awesome question. So your healthcare team can be your primary physician. It might be your social worker in your clinic. It might be your advanced practice nurse in your clinic. It may even be your attorney, who you consider a part of that team too. But these are many different resources that are available that you can sit down and talk with. Start the process of sharing some of your values and wishes, and also get access to many of these resources for many of those providers. Any other questions?
Thank you.
What was the advanced, you're talking about an adjunct medical person with your doctor? There's an advanced training, advanced something.
Oh yeah, I mentioned advanced practice nurse.
Oh, okay.
Yeah, so they are nurses who have done master's level training in providing individualized and more higher level care to patients. So they practice independently without physicians. And then there's also physician assistants, which I should have mentioned as well, who practice independently and care for patients as well.
Hello?
Yes.
Sometimes I get a little confused. I go to Northwestern, and sometimes the either a medical resident or a PA comes in and sees you first and goes over all the stuff for the day's visit.
Mm-hmm.
And then and everything up to date, blah, blah, yeah. And then the doctor comes in and wants to go over the same thing again. It's like, sometimes I've actually said, we just went over that, it's in my records.
I know.
How do you feel with that?
For sure, when the resident comes in, the doctor has to supervise them. So that's why the doctor's coming in after the resident. I'm hoping the visit is much shorter with the doctor than it was with the resident or medical student who came in beforehand. But very often, physician assistants practice independently, irrespective of the physician. That changes a little bit depending upon the complexity of the medical care. Sometimes if a physician assistant is working in a surgical clinic or an oncology clinic, then they definitely still have a physician come in and sort of see the patient after them, just to make sure everything is up to snuff with the recommendations. Yeah. But I agree, it can seem kind of complex to get 2 visits in one.
So how does,
Kathy Williams has her hand up.
I was just wanting to say about advanced directives. I worked in healthcare for a long time, that treatments change. And what you may decide when you fill out that advanced directive may be different in 10 years because the practice of whatever that decision may have been has changed. And the average person's not going to be keeping up with this, isn't going to know. For example, at the beginning of the pandemic, I didn't think I'd ever want to be intubated, but as they began to do that so often, they changed their ways of handling it so that it wasn't so damaging to patients. Those kinds of things are hard for the individual to know or to keep up or to make decisions about.
And, you know, Catherine, you're absolutely right. I think advanced directives, setting them up is a process. It is not a one and done. So your wishes may change over time based on your values, or like you said, based on medical care changing over time. But I think the importance is state your values. State your wishes about healthcare related to those values, and realize that it is a process, meaning that it should be revisited over time with your physician. And different junctures of where we revisit it is if there's a change in your health status. Let's say there's a new pneumonia, or let's say there's a new diagnosis of a malignancy. That may very much so change what someone would choose as far as their medical care. Or if someone's had a new epiphany as far as their value system, who I was 20 years ago is very different than who I am now. So I think that's a great point, Catherine. Thank you.
I just want to comment, Dr. Williams has put up on the screen the link to the survey that she'd like us all to complete. We will send that out to you in an email. We took attendance for who's here, and we will send you an email as long as we have your email address.
Thank you, Barbara.
Rita?
yes, at your center, do you assign people to a social worker or suggest a advanced practice nurse, or how does that work where you work?
Great question, Rita. So I work at the South Shore Senior Center, which is the premier geriatric clinic in the city of Chicago, probably the entire world.
I will agree. I go there.
And each of our providers has a particular social worker as well as advanced practice nurse that's assigned to our practice. So for myself, I have a advanced practice nurse by the name of Sonia Rawls, who sees all of my patients with me. And then my social worker is the amazing Christina Bernhardy. So very often if I'm seeing a patient and we've discussed their values and their wishes for their advanced care planning, we have the discussion in clinic. I set up an appointment for that individual to meet with my social worker, either this visit or the next visit, to establish their wishes in writing. And then we send them home during that visit with a copy of the advance directive so that they can discuss, and I call it homework. We give them homework to discuss their wishes with a loved one or their entire family about what their wishes would be, and to choose someone to be their healthcare power of attorney.
Well, that's very nice. It seems like a very good system.
Right.
But everyone's different. It doesn't have to happen in your doctor's office. Just as you have the resources here, you're able to pull up those resources, start reading through them, start journaling about what matters to you, talk to a loved one. And then when you go in to see your physician next time, you can talk to him or her, or even your advanced practice nurse or social worker, and let them know what some of your wishes are. And if you're ready at that appointment, you can actually do the documents.
Thank you.
The only thing we can't do is what's called a financial power of attorney or a will for property. But related to your will for healthcare, we can do in our clinic, but nothing related to property or finances. Any other questions or thoughts?
Can I ask you a question
Oh, please.
or just make a comment? When I went through recently, it was a hysterectomy after they found some ovarian cancer, but it was stage 1, and it wasn't in any lymph nodes, and it was only 51% into the lining of the uterus, I mean. And so they suggested this radiation. It was only like 5 small doses. And when I met with the oncologist, it was stressed that there could be minor consequences of diarrhea and fatigue and incontinence and these kinds of things. Very rarely were there severe consequences. So after I read the notes on my chart from this meeting, it was reversed. The severe consequences were highly stressed, and the minor ones took up a lesser importance. And I felt as though the doctor was covering herself in those notes, but I didn't know for sure. So it left me with a quandary as to how do I get the correct information.
Mm-hmm.
And so I'm sorry that there isn't something like what you're doing right now, which is kind of late stage planning for kind of pre-late stage planning, to offer patients some way to work through what their options are apart from what the medical establishment has said, because medical establishments, they want to heal you. You know, they have ways that they can heal you, but possibly at a cost. And it's just something that I feel we could work on sooner than later.
Yeah, so Nancy, I think something that you said that's really important is being an advocate for your healthcare. So I think it's definitely important to be really honest with the surgical oncologist you met with, and talk a little bit about what your concerns are and what you read into the discussion and what is important to you, and how those minor as well as those major potential side effects could impact your individual life. All of this should be very individualized based on the person and who they are and what they value. Because I can't give a recommendation to you based on another female who's same age and maybe even similar background. She may have a totally different value system in what those side effects may mean for her life. So it really has to be individualized. And the more you all serve as your own advocate and state what your individual values are, the better it will be, not only for you, but for the next patient that comes along, because it's going to really impact that healthcare provider to think about that when they're giving a recommendation.
Thank you.
Any other thoughts or questions? Thank you so much for your attention. I always enjoy working with your group. It's very lively and engaged, which I enjoy.
Well, we want to thank you so much, Dr. Williams. You gave us a lot of good information and resources for all of us to start thinking this through and making sure we're know what we want to communicate and how to communicate it to our healthcare provider and healthcare team. And so, as I mentioned before, we will send you the link to the survey in an email at some point in the next day or two, after, hopefully later this afternoon. And it'll have the link to the survey. It's a very brief survey, and what shouldn't take you much time to complete it. So this concludes the program portion of today's drop-in. I'm going to stop the recording. Again, I want to thank Dr. Williams and everybody who attended today. We will leave the Zoom open for 15 minutes or so if people want to visit and talk to each other. But again, thank you all very much for attending. And since our next drop-in will be after Thanksgiving, want to wish everybody a happy Thanksgiving holiday, and we'll see you for our first drop-in December. So thanks, everyone. And thanks again, Dr. Williams.